Today on Investigate TV Plus, insurance companies accused of using tech to deny thousands of claims in just seconds. I'm Lee Zurich.
And I'm Tisha Powell. We investigate one major insurer's process and its possible impact on families across the country.
This is not a computer issue. I'm a human. I'm having human issues.
Plus, Social Security recipients learn they've been overpaid and they are potentially on the hook for thousands of dollars.
The scary part of this is I'm just one step away from being homeless.
We go in depth to find out why it's happening to millions of people.
We have stories going back 35, 40 years. People are just terrorized.
And a passion for a school pantry inspires others to support students in need.
Everybody knows Miss Darga and loves Miss Darga, and she is just like the heart and soul of our school and our community.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
A lawsuit filed in 2023 claims a major insurance company used a computer program to deny some claims in less time than it took me to say this sentence.
Yeah, the insurance industry has long touted technology and using an electronic system as the solutions to high medical costs and slow claims processing. But we found accusations that it's not always working to patients' benefit.
This is personal. This is really hard.
A very personal story of building a family turned into what Amanda Bredlow says started to feel like a cruel game where insurance denials felt anything but personal.
I was getting turned on this very convoluted pinball machine of a path that didn't end up getting anywhere.
In January of 2020, Amanda and her husband, like many couples, decided they needed to turn to medical professionals to conceive a second child. It would be expensive, but they found a plan.
We saw that this policy covered infertility treatments, and we wanted to take advantage of that.
But quickly, they started facing problems using the coverage.
We started doing the treatments, and then we started noticing that we were getting denied.
Each time, she says, they'd file, they'd be sent a letter, told the filing was a duplicate and invalid. And at least once, the exact medical treatment code listed as covered in the couple's policy apparently didn't apply. And no person she talked to, it seemed, could help her.
The reasons were very vaguely worded. It was like, this is not in accordance to our policy or something like that.
Then the couple saw an article by ProPublica, an article that claims Cigna-employed doctors were signing off on rejections without even reading the files, denying some claims at an average rate of 1 every 1.2 seconds.
My husband just had like a light bulb aha moment, like must be what's happening to us.
In California, attorneys who work with clients on consumer issues also saw the same story and investigated further. Now they're representing a client suing Cigna and plan to pick up more through class action. The lawsuit accuses Cigna of using a computer algorithm to systematically deny claims in bulk without proper review by a doctor, something the attorneys on this case say is illegal under state law and potentially against federal insurance regulations.
They're supposed to use doctors to open up the patient files and examine the claim, examine the patient's history, complications, etc., to then use their expertise to determine whether that claim is medically necessary, whether that procedure was medically necessary. And Cigna is not always doing that.
Instead, attorneys explained to us there's a system called Procedure to Diagnosis, PXDX. It's a computer program that matches patient procedures with a diagnosis code. If the two don't match what the policy considers medically necessary, the computer denies the claim. And attorneys claim a doctor just rubber stamps that denial without a real review. In some cases, people weren't reimbursed. In others, they may not have gotten necessary treatment. In 2 months, 300,000 claims denied. Cigna wouldn't talk to us for this story, but published a rebuttal to criticisms online, stating that its PXDX program was only used in a small group of inexpensive procedures, that 94% of claims in that system were approved, and that it has successfully helped us accelerate payments to physicians for tests and treatments. Our investigation found Cigna isn't the only company accused of issues with claims processing. State enforcement records show Blue Cross of California was fined after admitting it had a coding error for more than 5 years that incorrectly applied certain office visit costs to deductibles. The insurance company said it found nearly 60,000 affected claims, amounting to an $8.5 million error. It repaid customers years later.
At the end of the day, the people this is affecting are humans. These are human problems that I'm going through. Having an infertility diagnosis is a human problem that I have to deal with every day. And this is something that is not being taken on with a human approach.
Amanda and her husband have no idea if their claims went through PXDX. In fact, attorneys say it would likely be difficult for any of the hundreds of thousands of Cigna customers to know. The only way to find out is likely to try to sue and find out through the court process.
My time was diminishing. I mean, I have limited time to try to do these procedures. I mean, as you get older, you run out of time. So I didn't have time to keep fighting this insurance company.
The lawsuit wants to stop Cigna from using PXDX and get clients money back for the money denied in claims. That case is filed in California federal court. Attorneys say nationwide there are more than 18 million Cigna customers. Cigna has not yet filed its response to the claim in court, and there are other similar lawsuits pending in other states.
Still to come, protection from surprise medical bills.
My daughter had no choice when she was unconscious on the operating table who worked on her.
We break down your rights when it comes to preventing costs that come out of the blue.
But first, selling prized possessions to pay back the government.
I sold a Snap-on toolbox that I've had since I was 18 years old. It was my pride and joy, and never would I get rid of it.
Why a miscalculation in Social Security benefits could become your responsibility.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download. Social Security is a lifeline for millions of seniors, but some have come forward with horror stories saying the administration wants some of the money they sent back.
Each year, around 1 million people get these notification letters demanding repayment. Investigative reporter Angie Riccono shows us how it could change someone's life.
Some of the overpayments are from years ago, and once Social Security catches their mistake, they're reaching out to get that money back. One man we spoke with outside of Kansas City got letters saying he owes tens of thousands of dollars.
Everything was good, and then here comes this letter saying that I owed them $62,000 back money.
What did you think when you opened up that letter and you
I
saw?
I didn't know what to think.
Tim Middaugh lives in a red and white trailer in Peculiar, Missouri. He has a rusted truck he needs to pay taxes on and a cat. Can you pay him back?
No, there's no way. Like I said earlier, the scary part of this is I'm just one step away from being homeless.
Tim has sold guns and jewelry to stay afloat. There's not much else.
I sold a Snap-on toolbox that I've had since I was 18 years old. It was my pride and joy, and never would I get rid of it. It's gone.
Tim agreed to a payment plan he describes as a hostage situation.
They threatened me and said they're going to take it all. So
he now lives on around $1,000 a month once Social Security takes its claw back.
But it's just, they beat me to a pulp.
There's got to be a solution here.
The issue was recently discussed in the House Ways and Means Committee.
Now, these are people that, they were living by the rules. They thought they were doing everything fine.
Testimony revealed just how common this problem is.
We have a number of how many people have been impacted by these overpayments.
So for the number of people, beneficiaries experiencing an overpayment each year for FY 2022, 1,028,389. For FY 2023, $989,912.
That's right, about 1 million people a year get surprise letters. Examples are now being collected and even categorized by financial columnist and author Terry Savage, along with economist Lawrence Kotlikoff. The website is aptly named SocialSecurityHorrorStories.com. My disabled son was told he owes $20,000. Pay $3,800 or else.
We want an 18-month statute of limitations. If Social Security makes a mistake, they should catch it quickly. After 18 months, it's their problem, not yours.
The man we're speaking with, they're going back to 2008.
Oh, we have stories going back 35, 40 years. People are just terrorized by these pay in 30 days or else. And the or else is they have all the power to stop your check. That must end right now.
Social Security's annual overpayments add up. In 2022, the clawbacks added up to more than $3 billion. Tim can't speak to billions, but he can tell you all about $530. That's the amount Social Security is holding back. He's trying to adjust.
I went to the grocery store out here last night, and the gal made the comment, I can get all this in one sack if you want to, and I said, that's fine.
We recently sat outside of Tim's trailer and talked about budget TV dinners, and Tim admitted to splurging on soda pop.
They beat me down now that I take 3 kinds of antidepressants.
Something he blames on Social Security. We wanted to find out more specifics and exactly how much money he owes, but when we reached out to the Social Security Administration, we never got a response. Experts say your best way to avoid these mistakes is to check the earnings history Social Security has for you. You can get on the Social Security website to find your information. In Kansas City, Missouri, I'm Angie Racono.
The Social Security Administration says benefits are overpaid when they cannot accurately calculate your benefit amount because the information they have for you is wrong or incomplete.
If you get a letter about overpayments, the administration says you can request a waiver if you cannot afford it or feel the overpayment is unfair. They ask you to mail or fax paperwork to your closest Social Security office.
There you go. Thank you for shopping.
Coming up, one woman's dedication to connecting families with critical resources.
They can get diapers for their babies today, even if they're broke. You know, when life hits, we're here to be able to help.
But first, hope for those facing high medical bills, the law that protects you from surprise cost.
It was kind of like we had been through something horrible and now we were going through it again. So it brought back a lot of emotions too.
One in 5 insured adults have had an unexpected medical bill from an out-of-network provider. But since 2022, federal law protects against surprise medical bills under certain circumstances.
Investigative reporter Cassidy Williams explains how you might be able to get a big bill wiped away.
Megan Lomasny was only a few months away from officially becoming a physician assistant when she got unexpected news.
She was diagnosed with a brain tumor. They think that she had this brain tumor for like 10 or 12 years and she didn't know until it got to kind of a critical point.
Megan gave her mom Rita permission to share her story. In March 2022, Megan went through a 6.5-hour brain surgery. After a few months of recovery, she was able to graduate. She had just started her new job when in February 2023, they got another surprise, a bill for $9,422.
It was kind of like we had been through something horrible and now we were going through it again. So it brought back a lot of emotions too.
The bill was because someone in the operating room was considered out of network by her insurance company.
My daughter had no choice when she was unconscious on the operating table who worked on her, and she shouldn't have to pay for an out-of-network doctor under those circumstances.
Her instincts were right. If you choose the path of an in-network provider, you can't later be charged an out-of-network price. It's called the No Surprises Act. It's a federal law that went into effect at the start of 2022. The law says an insurer has to charge you the in-network price if you didn't know ahead of time a provider was out of network.
Probably more often than not, if something doesn't look right, then it's not right.
Sean King is Connecticut's acting healthcare advocate. It's a state office that anyone in the state can call to get free help with health insurance questions and appeals.
We often refer to ourselves as the best kept secret in state government.
When the Lomasnys' first appeal was denied by their insurance company, they called the Office of the Healthcare Advocate for help. The office was in the process of helping them file another appeal when Lomasny all of a sudden noticed a change in their bill statement online. It now says they owe nothing.
There's right and wrong, and in this case, it was obviously wrong.
Lomasny hopes this is a lesson for others to always question a bill that doesn't look right.
Surprise surgery bills aren't the only way you can get hit with a big expense. An unexpected trip to the ER in an ambulance can be a huge financial burden.
Every little thing that's done to you in an emergency room, whether it's a CAT scan or putting on a Band-Aid, is probably going to be upcharged by a factor of 10. So, and that's hard to argue because ERs are allowed to charge a lot.
Reporter Carice Jackman sat down with Kaiser Health News to learn ways to avoid high medical cost. To find out more, just go to InvestigateTV.com and search costly care.
Still ahead, feeding students more than just knowledge.
Green beans? Okay. Oranges, awesome.
How the pandemic paved the way for a service that's helping vulnerable families.
I'm Viv Williams with a medical mythbuster moment. The myth: if no one in your family has breast cancer, then you won't get it. That's not true.
In the United States, we see that about 1 in 8 women will develop breast cancer in their lifetime. And 80% of women who do develop breast cancer don't have a strong family history for breast cancer.
Dr. Christine Clausen, director of the Mayo Clinic Breast Diagnostic Clinic, says regardless of your family history, all women should begin regular screening with mammography at age 40, because breast cancer can be curable, especially if it's detected early. With this medical mythbuster moment, I'm Viv Williams.
When kids have healthy meals, they feel better and can do better in school.
But according to the nonprofit Feeding America, 1 in 5 children live in food-insecure households.
However, there's help. Every year, school pantries serve 21 million meals to more than 100,000 children.
Reporter Lee Mills introduces us to a woman in Wisconsin who was inspired to leave her corporate job to help those in need.
Pick out what you need at home or a snack.
It's a school pantry, open all day long.
Green beans? Okay. Oranges, awesome.
For students and families in need in this Sun Prairie neighborhood.
You getting some stuff for families?
Yep, we need some cold, some paper goods, and some canned goods.
Awesome.
Every day, Stacy Darga
Butter
is there.
You need any toiletries or anything?
Yep.
Okay.
Helping each person get what they need.
We always do a needs assessment.
As the community school site coordinator at Westside Elementary.
My role is to go out and find those partners that will help us solution and fix those needs for those families.
I can call her with pretty much anything I need, and she can help me find the resources.
Hey Barry, how's it going?
Good.
It reaches beyond the walls of the school thanks to community members like Barry Malum.
Peanut butter.
He understands how life can take a turn.
We've had to use them too over the years.
And now works as a neighborhood navigator for the city, connecting people with resources.
It's a comfort level for everybody to know that they're not going to starve tonight. They can feed their children. They can get diapers for their babies today, even if they're broke. You know, when life hits, we're here to be able to help. And that's the most wonderful feeling ever.
Westside has a highly mobile population, and we often have families experiencing homelessness. So families will come in, they will be unable to identify a place that they're going to sleep that night. And so in partnership with Stacy and our social worker, we're able to really wrap around the family.
Stacy's work shifted during COVID. They started storing food in the school art room.
During the pandemic, it really showed how much schools are relied on by families, you know, because everything shut down. And it was like, oh my gosh, how are we going to get them breakfast? How are we going to get them lunch?
Stacy started going out into the community, running a daily mobile pantry, packing her van with bags of food, paper products, clothing, and school supplies, and stopping at sites around town to deliver food and check in with families.
I know that the pandemic, COVID was awful, but it allowed my role as a site coordinator, I feel like, to go deeper. Like I had to build those relationships. I got to start doing home visits with families. They saw me out there. They started to really trust, you know, and once you've got that trust in that relationship, then from there, that's where all the learning and all the support start.
A year later, in 2021, Westside became the first community school to partner with Second Harvest Food Bank through the help of the Sunshine Place.
She's got a big heart and a lot of big ideas to fill it. And she is constantly advocating for what the families need. You know, she thinks of them first. She thinks of what they're asking for first, and then translates and relays that back to us.
I call it walking the path with them. I love the kids when they come in and visit and they see us. I love the families. And to know that we're really, truly helping a need and serve a need that they have is just beyond belief.
She's one individual.
All right, here you go, love. There you go. Thank you for shopping.
Helping to give students food at home and hope for a brighter future.
She makes dreams happen. Everybody knows Miss Darga and loves Miss Darga, and she is just like the heart and soul of our school and our community.
Love you, Darga. Love you too.
One person making a huge difference. We have learned, by the way, she will retire at the end of the 2024 school year.
She's doing such wonderful work for the families in that community. It means so much for them knowing that they're supported in that way.
No doubt.
Well, that's it for us on Investigate TV Plus. I'm Tisha Powell.
And I'm Lee Zurich. Thanks for watching.
On the next Investigate TV Plus.
I believe every woman that is pregnant should have a doula.
The country's maternal health crisis is driving interest in alternative birthing care. We go in depth with the women working to support mothers and save lives.